There's this patient who travels overseas for dental implants, and the surgeon places the implant into his brain here in 2024. Whether you're looking to save money, or you just don't trust US dentists, or you're just trying to find out how a dental surgeon placed a dental implant in someone's brain, I have the right video for you. Hi, my name is Dr. Daniel Choi, and today I'm going to go over the pros and cons of dental tourism. And make sure you stick around to the end of the video so that you get my best advice as a board-certified periodontist if you're considering dental work outside of America. And for all of you guys that have gotten dental work abroad, tell me about all your experiences. Number one, where did you get your work done? And also, let us know what you got done and tell us all about your experience. Let's get started. So there was this patient who visited a dental clinic in Turkey because he was having pain and he was interested in dental implants. However, during his dental implant procedure, things started going downhill fast. The patient noticed the dentist struggling with the tool used to insert the implant screws, which wasn't working properly. Despite this, the dentist decided to insert the screws manually. The patient reported hearing a bone cracking sound and felt excruciating pain, but the dentist reassured him that everything was normal. As the dentist exerted excessive force, one of the screws pierced through the patient's jawbone and into the brain cavity, causing unimaginable pain. Realizing the gravity of the situation, the dentist rushed the patient to an emergency room, then fled. Thankfully, the doctors there acted quickly, removing the screw without causing brain damage. And after a few days of recovery, the patient was discharged from the hospital. So what are some of the pros of getting dental work abroad? Obviously, factor number one is going to be saving money. Due to the strength of the United States dollar, you can get a lot more bang for your buck in other countries when it comes to dental work. Turkey, Thailand, Mexico, Costa Rica, these are all countries that due to the strength of the US dollar, you can get a lot more services for a lot cheaper. Also comes factor number two. If you notice some of the countries I just mentioned, they're pretty often vacation hotspots. Not only can you get your dental implants done, but you can get a nice vacation at the same time. I just recently went to Turkey because one of my friends just got married there, and I gotta say, me and my wife had a great time, and it is a beautiful country. So the bottom line is there's definitely appeal to getting your dentistry done in other countries because, hey, you're getting a cheaper price and also you can experience a nice vacation at the same time. So let's talk about some of the cons of getting dental work abroad. One of the issues, especially with dental implants, is that these are not procedures that are usually done in a day or a week. There's a lot of time that your body has to heal, and so these steps need to be taken at different times, usually over months. So if you were interested in dental care abroad, understand that you would require multiple trips. If anybody's telling you that that can be shortcut, I would be very wary of that. And if you do some more research about this topic, you'll see that there's a lot of bait and switching that's happening with these people telling you that you can get everything done on one visit. I would highly encourage you guys watch some of our other videos because you'll understand why the body needs time to heal. Now, with these dental implant procedures, these are procedures that are done and your body's gonna have a response. Now, 95% of the time, there's never any issues, especially if your procedure is done right. Another question, if your price is going to be all-inclusive. Whenever you're doing these big implant procedures such as all-on-4, there could be many aspects of the procedure. We're talking specifically about the dental implants, also the prosthesis, which are the teeth. Also, do they cover the sedation? What if something goes wrong? Do they need to add another implant? What are the costs of additional implants? And get a clear definition of how many appointments you would need over what period of time. Now let's talk about something nobody ever wants to talk about. It's about difficulty finding local care. In the event something does happen, what is the likelihood that you're going to be able to get somebody to help you locally? That's something that a lot of people don't consider. Complications can actually occur during the middle of treatment, after your initial surgery, or the months of time that you're healing afterwards, or complications can actually occur later on down the road. A lot of times when you've had work done by somebody else and you are experiencing some complications, there are liability concerns for a dentist here. Now, let's say that you don't get any help locally and you decide to hop on a flight back to where you originally had your surgery. Okay. Well, there's another issue because these complications just don't give you like a week or 2 weeks or 3 weeks of warning. These things can happen overnight. So what's your contingency plan? Are we going to be able to hop on a flight immediately back to that country, which is 12, 16 hours away, and make sure that they work you in? And let's say you do have complications and you do need a revision surgery. Those surgeries are never as easy as they originally were. And so there can be potential further complications and more visits that you originally didn't anticipate. I'm not saying that everything can't go right or you can't find a great surgeon or a dentist out there. There's plenty of stories where people have had success stories, but understand that there's also things that can go wrong, and when they go wrong, they can go terribly wrong. I also have a patient that came in recently, and I'm gonna link it in the information above. You can check out that video. And again, I'm not trying to scare people, but there's definitely occasions where things can go wrong. Also, whenever we're trying to fix an all-on-4 or a dental implant case, it's never as easy as the original surgery. I actually have 2 patients that have come in the last week where they had dental implants for all-on-4 done. Unfortunately now, the difficulty of the surgery and the cost has increased dramatically as a result of the surgeries not being done right in the first place. When we're placing dental implants, we're actually picking strategic locations to place those dental implants to make sure you have the best result. If those dental implants go wrong, then we're trying to pick other locations which may not be ideal. As a result, surgery just becomes way more difficult for the surgeon. The costs become more significant for the patient. I had a patient yesterday who spent around $40,000 for her dental implants for an all-on-4 upper and lower just 3 years ago. And now she's sitting in a situation where you see that she's got broken teeth, her dental implants are failing, and now to do a revision surgery for her, she's now going to have to pay double what she originally paid just only 3 years ago. Now you have a patient that's spent over $100,000 when all they wanted was to be able to have the confidence to be able to smile again. A lot of these cases are heartbreaking, so what I've done is I've created a special PDF of questions that you need to ask any prospective dentist that is going to be treating you for dental implants. It's a free PDF so that you can just make sure you get the best result. Another factor is delayed complications. With a lot of this type of treatment, if things are not done precisely, then what can happen is you can actually have these delayed complications, not only 6 months, but years down the road. So you want to make sure that you have assurance that everything's going to be taken care of. Everyone's always excited about getting dental implants, and once you get the teeth and you see how beautiful it is, it's like you're 18 again, right? And we're all super excited. Getting dental implants is almost a little bit like buying a new home. Everyone's always excited about how beautiful their home is, but what can be lurking behind those walls could be a lot of issues that will manifest into bigger issues that you can see for a few years. Similarly, the same thing happens with dental implants. You can have those beautiful teeth, but behind those gums, you can actually have bone loss that's occurring that nobody's really detecting if the surgery wasn't done properly. I actually have a story of a patient who had her dental implants done abroad several years ago. Unfortunately, she didn't realize she had any issues until one day she started having pain. And when she came in for her 3D x-ray, we were able to see that several implants now needed to be removed. Which leads me to my final point. What if something goes wrong? You go into the dentist's office and he acts like he's never seen you before, or he's already done with you. Well, here in the United States, you have avenues such as lawsuits, dental board, and those are going to be advocacy agencies for you on your behalf, okay? But when you go to these other countries, they don't have dental boards. They may have court systems, but for you to be engaged with a lawsuit, it's not exactly easy to find an attorney over there that's going to be able to help you out. Another factor is if you actually had to show up for courts, I mean, how many flights would you have to take over there for that? So my final advice, just really make sure you do your research and pick a good provider. You can get messed up in Turkey or Costa Rica, and you can also get messed up in the United States. So research is the utmost importance. And also understand that if you decide to try to get fixed here because that doesn't make any sense for you anymore, that your costs are going to increase significantly because that second revision surgery is always going to be more complicated for the surgeon. That might really blow that budget wide open. Again, check out the PDF that I've compiled. Make sure that you enter your information to get that free resource because I think it's going to be extremely helpful because unfortunately, you don't know what you don't know. And if you found this information helpful, please make sure to subscribe, make a comment, give us a follow, give us a thumbs up. We really appreciate it. Thank you.